My name is Marty Kaplan. I'm on the faculty of the Annenberg School for Communication and Journalism here at the University of Southern California. I'm also the founder and director of something called the Norman Lear Center. Our mission is to study and to shape the impact of media and entertainment on society.
I'm the director of Hollywood Health and Society, a program of the Norman Lear Center that works to connect writers and producers to health experts and information for their scripts. Like it or not, we know people are learning from television and movies. That's why Hollywood Health and Society serves as a free resource to the industry. We work to inspire and inform storylines, to help writers make their stories more compelling by making them realistic and accurate. I'm thrilled to bring you this panel, Stayin' Alive, on what is known as the Affordable Care Act, or Obamacare.
And I now have the honor of helping launch the Affordable Care Act here in California. And so I'm going to frame this I might call it in the dragnet mode, just the facts, ma'am, about what the Affordable Care Act is and what it's not. Because for the last 3 years, there's been sort of a drumbeat of disinformation and misinformation and very little real facts. And we're coming up on January 2014, where the biggest elements of the Affordable Care Act will take effect. So let's frame this. This is a very, very big deal. Our vice president called it a BFD, but I'll just keep it a big deal. It's the biggest change in healthcare since Medicare was implemented 50 years ago. And in some ways, it's both more and less than what happened 50 years ago. It's less in that if you have healthcare coverage through your employer now, you keep it. If you have Medicare, you keep it. But it's more in that it's for the first time we as a nation are saying everyone has a right to healthcare. That is a very, very big deal. And with policies behind that to help people afford healthcare and to change the rules so insurance companies can't stop people from getting healthcare because they have a pre-existing condition. This is a very, very big deal. What it means is that for 45 million Americans that don't have insurance, all of a sudden we'll have the opportunity to have insurance. That's a big deal. For the working insured, people that have insurance for their job, it's a big deal because they know that they don't have to stay at their job to have insurance. They can actually know that they'll get insurance if they leave their place of employment.
So I want to tell you about Adela before Obamacare and what could have happened after, but this was before Obamacare. Adela is a beautiful 53-year-old Latina woman who had no idea that she had high cholesterol, diabetes, or high blood pressure until the day she landed in a small town emergency room. And it was likely that she had actually had a stroke that was too small to be picked up on her CAT scan. She was confused. I said, I think you've had a stroke. She said, I'm confused. I've been to the doctor every year, all these years, and I've been healthy. And I looked back, and yeah, she'd been to the doctor, but she'd been for PAPs. Under every woman counts, and all that was counted for her was a pap smear and a mammo. And it didn't cover the labs or anything like that. So because now she'd had a stroke and because now she had a disability, she could qualify for Medicaid. And we were able to get her an MRI, which confirmed that she had a stroke in her brainstem. So hypertension is the silent killer, and high cholesterol, you can't feel it till the damage is done, like your stroke or your heart attack. And diabetes doesn't really have symptoms until it's pretty severe. And all these were easily diagnosed with routine labs. And Adela is a tragic example of why we needed Obamacare and why we need more people to be enrolled and have health insurance.
Insurance gives us a huge storyline. It's very dramatic for patients not to have insurance and for our doctors to push for them. So Obamacare is going to be extremely bad for our drama. I've been watching Call the Midwife. If anybody's watched that, it's a BBC show. And what's interesting about that is I think that's where we're going to be headed with Obamacare, because they're always talking about, without the National Health Service, we wouldn't be able to do this. And I think there's going to be a lot of that going on now in the medical shows. So it's really interesting to see how it affects drama.
So I'm really interested in telling the stories of healthcare, and certainly the fundamental human right, as Peter said, to healthcare, and how that's such an issue in this country, which is kind of, mind-boggling, but still is. And so how do we normalize the view that people have a right to be healthy? And I think one way is through storytelling, certainly, and the way that we can tell those stories that can invigorate us and make us, talk to our legislators and talk to each other and talk to providers and talk to insurance companies. And that's what happened with Affordable Care Act. But I think we have to really think hard about health care as the care before we go to the doctor and how preventive care will really come to the forefront.